Welcome, everyone, and thank you for joining us today. My name is Melanie Chasteen, and I am the Director of Community Engagement for the Texas Campaign to Prevent Teen Pregnancy. We are so excited to be hosting this session in partnership with the National Center for Youth Law. This webinar will address the promotion of sexual and reproductive health for youth in foster care. Before we get into the content of today's webinar, I want to share a few tips for using the webinar platform and a bit of background information about the Texas Campaign. First, we have muted all participants to help reduce background noise, but we welcome your participation and questions using the Q&A function you see at the bottom of your screen. If you have a question for our presenters, please submit it using that tool. We will have time to answer questions at the end of the webinar. Also, we will email a PDF version of the slide deck to all participants following the session, and we will post a recording to the Events and Training tab of our website at txcampaign.org. Finally, we are always looking for ways to improve the trainings and resources we provide. At the end of this webinar, you will receive a survey via email. Please take a moment to share your feedback. We truly value your input and use this information to inform our work. An important note for those who are seeking social work, licensed professional counseling, or continuing professional education CE credits, this evaluation is required. I want to extend a warm welcome once again to our partners and colleagues joining us from across Texas and in other states. For those who may be engaging with us for the first time, the Texas Campaign to Prevent Teen Pregnancy is a statewide, nonpartisan, nonprofit organization dedicated to reducing teen pregnancy through research and data dissemination, advocacy for effective public policies, strategic collaborations, as well as training and events. We have the privilege of working with a diverse group of stakeholders from across the state to achieve this mission. As a small organization with a statewide reach, last year we began leveraging the power of webinar technology to increase our engagement efforts. We would love to know about any topics of interest to you, and there will be an area in the survey where you can provide suggestions. And lastly, just a quick note on an upcoming event hosted by the Texas Campaign that we invite you all to attend. On April 6th through 8th, we will be hosting our 9th annual Statewide Symposium in San Antonio, Texas. This event brings together hundreds of youth-serving professionals for training and networking opportunities. Visit txsymposium.org for more details. The early bird deadline for registration is February 4th. And now I will turn it over to our fantastic guest speakers, Rebecca Gudeman and Felicity Reyes from the National Center for Youth Law.
Thank you so much. We appreciate the opportunity to be here with you and share a little bit of your day. My name is Rebecca Gudeman, and I'm the Senior Director of Health at the National Center for Youth Law, and I'm joined today by Felicia Reyes, who is a Program Associate in our Reproductive Health Equity Project. Unfortunately, Leslie LeGras-Morris, the Director of that program, is not able to join us, but we will be sharing out information and providing a link to her email and contact information should folks have additional questions for our director. Just really quickly, the National Center for Youth Law is a law and policy organization, a nonprofit. We're headquartered in Oakland, but we have offices around the country. We work on law, policy, education, technical assistance, often partnering with local partners to move forward issues in child welfare, juvenile justice, education, health, etc., to improve the lives of young people. Today, we're going to be talking a little bit about a project that we have been piloting in California and in particular in Los Angeles with a number of local partners. We will start by reviewing the sexual and reproductive health disparities experienced by youth in the foster care system and identify some of the structural drivers that allow these disparities to flourish. Then we'll introduce that project I mentioned, which is using cross-sector collaboration to promote sexual and reproductive health equity and address some of these disparities. And we will introduce some of our work and strategies that using the Head, Hearts, Hands framework, which is how we think about our work. Head is about policy development and implementation. Heart, community engagement. Hands is about the on-the-ground training, education, promising interventions, and obviously we'll explain that a lot more as we move forward. And perhaps most critically, from that work, we will flag some of the promising practices and lessons learned from California in our 5 or 6 years of promoting and working on these issues. And for right now, I am going to pass it over to Felicia to kick us off.
Hi, everybody. So I'm going to talk a little bit about LA REP. So LA REP is the Los Angeles Reproductive Health Equity Project for Foster Youth. It's a collective impact campaign that focused primarily on LA County, which has about 30,000 youth in foster care. And its main goal is ending inequitable reproductive health outcomes for youth in foster care, including disproportionately high rates of unintended pregnancy. The campaign seeks to end harmful narratives and also shift perceptions of what it means for trusted adults to support the healthy sexual development of young people in foster care. Next slide, please. So now I'm going to talk a little bit about the reproductive and sexual health disparities experienced by youth in care to give our work a little bit of context. I want to start off by putting the issue within the context of California. California has a pretty comprehensive network of services in place to address adolescent needs. These include comprehensive sexual health education, consent rights, a network of clinics, public funding streams, and trustworthy information for teens and adult caregivers. Next slide, please. However, even with these reproductive and sexual health services in California, pregnancy rates for foster youth are running counter to the national trend. It's also important to note that our early pregnancy rates for youth in foster care here in California do mirror the national data for youth in foster care in general. As you can see from the chart, by age 19, 49% of females in care will have reported being pregnant compared to 20% nationally. And by age 21, 59% of females in care in California will have reported being pregnant, even though the teen birth rate in California is down 80% since 1991. Slide, please. These disproportionate rates of early pregnancies are not just in California. Other states have reported on this disproportionality as well. A report produced in Missouri states that 55% of young women in foster care had been pregnant, and 23% of males in foster care had fathered a child by age 19. In Massachusetts, 43% of youth in foster care had been pregnant or caused someone to get pregnant. And a Texas report stated that young women aged 13 to 17 in foster care are nearly 5 times as likely as their peers to become pregnant. So this is across the board nationally. Next slide, please. Next, I wanted to speak to this idea of intentionality, whether a pregnancy is intended or not intended. Although some young people in care do say they want to become pregnant to create a family or fill an emotional void, this is not the majority of the cases. In the chart, you see that 70% of males in California reported not having an intended pregnancy with a partner, and then 66% of males in California reported not having an intended pregnancy. This data shows the majority of these pregnancies are not intended. Next slide, please. So youth in California foster care also have disproportionately poor prenatal outcomes. Of foster youth surveyed at 17 who reported, over 40% had a stillbirth or miscarried, and 20% never received any type of prenatal care. As you can see in the pie chart, 11% had an abortion, and 35% resulted in a live birth. And then how does this compare elsewhere? Well, female youth in the Midwest study in Illinois, Iowa, and Wisconsin who became pregnant while out of care were more likely to receive prenatal and postnatal services than female youth who remained in care. And I just wanted to state some statistics for the general population to give somewhat of a comparison. So in 2010, the majority of pregnancies to adolescent females ages 15 to 19 in the United States, an estimated 60% ended in a live birth, compared to this 35% you see in this chart. 15% ended in a miscarriage, and 30% ended in abortion. So these are very different statistics from the ones that you're seeing here on the screen. Next slide, please. We really want to drive home the gap between intention and outcomes. Why is it that most young people are not intending to have certain outcomes, and yet these certain outcomes still persist? Well, we need to ask, sorry, could you go back, please? Well, we need to ask ourselves, what is it in the youth's power and control? Again, think about it. They may have limited power over various aspects of their lives. What is in the youth's sphere of influence, and what additional barriers or issues must the youth contend with? These questions are meant for you to really think about the context. It's important to move past explanations that blame the victim and think about the context of the situations that these young people are in. Social determinants of health are the public health framework we use to understand how structures and institutions uphold poor health outcomes. This model explains that the conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. These conditions are known as the social determinants of health. Social determinants of health include factors like socioeconomic status, education, neighborhood and physical environment, employment, social support networks, and access to healthcare. So for example, what if I have a cisgender Black female living in a housing project, the local school she attends does not offer sexual education, and she comes from a single parent household where her mother has both very limited time and money because her mother works 2 jobs to make ends meet. In this situation, there are many conditions in this young girl's life that negatively impact her access to both education and resources for her reproductive and sexual health. Next slide, please. So nationally, youth in foster care experience unique risks and circumstances across the board. So this lists a few of them, such as in early adolescence, youth who have experienced trauma may enter puberty up to a year earlier than peers and are twice as likely to identify as LGBTQ. Adolescent girls in physically abusive relationships are 3 times more likely to become pregnant than non-abused girls, and 49% of females in foster care report forced sex at some point before age 19, compared to just 11% in the general population. The majority of sexually trafficked youth are involved in child welfare, and youth in foster care are disproportionately youth of color, with the highest disproportionalities for African American youth. Another piece of our work is addressing the structural barriers to healthcare. So youth in foster care may have or experience lack of knowledge regarding reproductive and sexual health rights that include placement and school instability, bias from providers and professionals, making them less likely to seek care and access follow-up care, logistical issues like having reliable transportation to get to doctor's appointments, concerns about privacy and having a lack of askable adults or adults that they trust to talk about these things with. And then the adults, such as social workers, health providers, and caregivers, may also have or experience a lack of clarity on policies, laws, and obligations, bias or religious objections, confusion about consent and confidentiality rights, inadequate training on how to have age-appropriate sexual health conversations with young people, and then also fear or liability issues. So there can be a ton of structural barriers that can make it very, very hard to access reproductive and sexual health resources for young people in care. So these are some quotes from caregivers on how they experience barriers. So this says, I was just thinking that if a kid is in foster care and the child is to reunify with the parents, who are we to talk to their kids about sexuality? So there's all this confusion about what they can and cannot do. A young person stated that none of my foster parents, and I had 14 placements, ever brought up the issue. They were able to establish a curfew and don't do this and don't do that, but never sit down and do a one-on-one talk. Next slide, please. In a report titled Fostering Healthy Texas Lives, it stated that in Texas, only 38% of 126 child welfare providers that responded to the survey indicated that their agency had a plan or protocol to assist with teens preventing pregnancy and sexually transmitted infections. Here are some of the actual quotes from social workers. So some said, I was just pulling things from out of the air because I really didn't know what was available to her. Another person said, I don't know how far we can go into a conversation. I just avoid certain topics. And then this other person mentioned, I didn't ask about pregnant teens. I didn't ask a pregnant teen whether she was getting prenatal care or any other questions. It was beyond my comfort level. I don't know what they are thinking. I just keep focused on IOP stuff, bus passes, and workshops. So again, there's a lot of confusion about what is available and what should be done, even from the trusted adults.
All right, thank you, Felicia. So now it's back to Rebecca, and great, we present all this information. We know that there's some big gaps. What can we do? There have been a number of folks who've looked at this and flagged key opportunities and spaces that we can help start addressing these disparities. The Texas report that Felicia alluded to did a nice framing on sort of steps to take, as has a number of other organizations and reports, including a report from the formerly known as the National Campaign to Prevent Teen and Unintended Pregnancy, now known as Power to Decide. Some of the key factors that folks flag in these reports include knowledge, ensuring that both youth and the key adults in their lives have comprehensive, accurate information, access, addressing tools and services, but also critically identifying those unique barriers that may inadvertently get in the way of a young person accessing the healthcare services that they need. Really critical to foster those relationships with trusted adults so that a young person has somebody that they can go to when they need guidance, inspiring motivation, and then critically clear policy and rules. This is such a sensitive and tricky area. So many of us adults never received wonderful guidance. Making sure that we all know what we can, can't, may, and must do to support youth in their healthy sexual development is critical. So with that in mind, a group of California organizations, both public and private, got together about 6 years ago and tried to frame a project that would allow us to move work in all of these areas, and that is, of course, the LA RIP project. As alluded to earlier, we have framed or packaged the work we're doing into this head, heart, hands model. Head addressing that policy and law, heart addressing community engagement and bringing youth voice into our work, and hands developing training, tools, and promising interventions. And so I want to just go through a couple examples of our work and sort of what's happened. So in the hands area, we picked a number of training and interventions to pilot in Los Angeles between actually about 2016 and 2018. We focused on creating trainings in partnership with our expert organizations. And we focused on 5 different stakeholder groups: the courts, the judges and attorneys, the child welfare social workers, foster caregivers, both group home, congregate care staff, and individual foster parents, healthcare providers, and youth. In all but one case, we created a training on sexual and reproductive health, wellness, and rights. And then we piloted it and evaluated it. And our evaluation strategy included a shared measurement approach that used sort of the same infrastructure for evaluation so that we could understand and compare and contrast across the different pilots. We also used sort of similar content, shaped, of course, for the particular group that we were training. so that there would be some consistency when a foster parent, for example, gets a training and a young person gets a training in the information that they receive. We did this evaluation and then had our evaluators put together an evaluation brief, and then we did a number of webinars to report out the information. I will give you a link in just a second where you can find all of our briefs, but just as an example, with young people, we piloted a sexual health curriculum called Making Proud Choices, which was specifically designed for youth in out-of-home care. It addresses not just the birds and the bees, but also information on healthy relationships, on negotiating consent, on body basics, on puberty. It goes far beyond sort of the core components of what people traditionally think of as sexual health education. We had just under 90 current and former transition age foster youth participate. We did provide them some funding in order to participate, and we did a pre, post, and 3-month post survey evaluation. The good news is that all knowledge measures increased from pre to post and remained high. We also saw impacts on actual practices and behaviors, including an increased use of effective birth control and actually a decrease in risky sexual behavior. One of the things we did, though, note in our 3-month follow-up is that some of the learnings and knowledge did go down. And so one of our lessons learned is, and this is no surprise, it's true in all of the trainings we did, you can't sort of just say train once and you're done. This is about knowledge that we continue to provide over the course of time. So we're currently now working with our partners on what we're calling sort of booster shots of information, or making sure that young people know where to go for additional information moving forward. We also took note of sort of better practices and strategies for engaging young people, concrete information like providing food at every curriculum, every time we had a curriculum presentation, making sure that we addressed issues like transportation and childcare for those who needed support in that. We even tried providing the curriculum in different sort of packages, 4 days, once a week, 4 hours a day, versus an intensive 3-day, 5.5 hours a day, to see sort of how we could make it easier to access and also ensure that they received the knowledge that we were hoping that they would receive. Like I said, this is just sort of a few highlights of what we did. We do have, you'll see at the bottom of this screen, a link where you can find the full evaluation brief on our implementation of that training, and you'll also find information on the other trainings we developed and evaluations on becoming a foster-friendly health provider, the training we created for social workers, and the training that we have for court professionals. And I will say, just as an example, with the healthcare provider training, we found that before the training, the healthcare providers were very confident that they had the knowledge they needed to provide good care to foster youth, but their confidence far exceeded their actual knowledge. And we found that pre and post, many of them actually showed a dramatic increase in their knowledge and skill level. The training focused both on practical tools and sample language to use when you're in a healthcare setting with a young person, as well as sort of background law on consent, confidentiality, child abuse reporting, which is always so important for healthcare professionals. Some of the practical tools that are addressed in the healthcare training, we found, and I should say we have a youth advisory that Felicia will talk about a little bit more in a second. They helped create and inform all of the trainings that we developed. Some of the really important information that they conveyed is it's sort of the way even that you frame questions in a healthcare setting. So if you're going to ask a young person if they have any been sexually active, you don't say, have you ever had sex? Because many young people may have been sexually assaulted or have experiences of traumatic sexual experiences. And how do you answer that question when your only sexual experience may be of molestation? Or the way that you approach a physical exam with someone who may have a history of physical abuse. So it gets into real concrete tips and tools that were created by healthcare professionals who have a long experience working with foster youth. In addition to the trainings that we piloted, we also piloted a number of interventions. One example is called the Expected and Parenting Youth Conference. This was developed as a partnership between the LA County Child Welfare Agency and a number of nonprofits. It's a completely voluntary case planning program that is offered to any young person who finds out they are pregnant and is choosing to continue the pregnancy and wants to become a parent. A core principle of our work is that the youth is at the center, and we know that for some young people, having a baby is the motivation to move ahead and achieve goals that perhaps they hadn't felt were sort of in their reach before. And so these conferences are about helping them navigate some of the potentially very complex issues that come up for young parents and help them achieve their goals. It addresses things from housing to education to bus passes to where do I find a crib, or other very concrete sort of immediate needs. In our evaluation of the program, we did a series of phone interviews with young people who had both were currently in the case conferencing and those who had completed the EPY conference and were several years out to see what kind of impacts that it had made on their lives. I won't read all these quotes, but just as an example, one of the young people said, I reached all my conference goals. I was homeless for a little while. I was in a motel with my baby, but there was light at the end of the tunnel. I made it with both of my kids, but if the conference staff weren't there, I don't know, I probably wouldn't have my baby with me. And part of the goal of these conferences is to really help support young people so that their young children won't end up in the child welfare system as well. You can find a link at the bottom of this slide to both a toolkit that describes the conferences and how they are set up, and to the evaluation that we did of the conference intervention. So we piloted a number of different trainings and interventions like these, and then based on that, made some judgment calls about what was worthy of trying to expand, and both throughout Los Angeles County and in California. And that's where law and policy development comes in, and some of the work we were doing in that area. So through our work and through some of the research that was available, we knew that there was a deep need for training and education for social workers, for foster parents, and for young people. A few of the organizations in our partnership sponsored a law in California that was passed in 2017 that does a number of things. So Senate Bill 89, which went into effect in July 2017, first places a duty on our child welfare agency to ensure that every youth in foster care age 10 and older receives comprehensive sexual health education. Now, as Felicia noted earlier, in California, we do have mandatory comprehensive sexual health education in our middle schools and high schools, and we knew that young people in foster care were not accessing that education at the same degree and to the same level as young people in the general population. And so this duty on the Child Welfare Agency to ensure that youth are accessing this information is really just trying to make sure that they get the same information that every other young people is getting. If for some reason they're not able to get it through school, the Child Welfare Agency is responsible for connecting them to a community-based education program. The law also put a duty on the child welfare agency social workers so that starting at age 10, once a year, their social worker is required to check in with them, let them know what sexual and reproductive health services they have a right to access based on our state law, and ask them whether they faced any barriers to accessing that care, whether that's transportation or logistics, etc. And then finally, it required mandated training for caregivers, social workers, and judges that would address both the the obligations of the system, the rights of youth, and critically, how to have supportive conversations with young people about some of these very sensitive topics. It also, it's not on the slide, critically puts money from the state budget into this work so that the agencies would have the resources they needed to provide that training, to take that extra bit of time once a year with a young person and to address their sexual health needs. In addition, our State Department of Social Services developed back in 2016 a work group called the Healthy Sexual Development Work Group, and the name is important because the state agency wanted to acknowledge that for young people who are in care, the state does have an obligation to support healthy development, and acknowledging that by pure biology, once someone hits the teen years, sexual development is a part of that development. And if the state doesn't embrace that and support healthy sexual development, we are leaving great potential for young people to leave care without having had the support they need to make healthy choices and to be able to realize their choices. The Healthy Sexual Development Work Group brought together a number of expert organizations and partners from the state, and together with the Department of Social Services, they did a range of things. They updated regulations for congregate care and foster parents. So, for example, now address very explicitly whether a young person can have contraception while they're in a group home facility or in a foster parent's home. The regulations say that they can, that it is legal for them to have that and have it in their own private storage. There have been a number of regulations and policy changes that make quite explicit what the rights of youth are to sexual and reproductive health services and the obligations of the foster parents, congregate care facilities, and social workers to support access to care. So an obligation to provide transportation, for example, an obligation to help facilitate making of medical appointments. And then they also issued a number of guidance documents that address frequently asked questions. So, for example, on transportation, there's a lot of questions about, does that mean I literally have to put someone in my car and drive them anywhere they want to go? The guidance addresses if this is not something that you personally can do, what are some of the other ways that you can facilitate transportation without you having to engage? The department also created a number of materials, including some materials for foster youth that they printed and are also available on their website, and they created some model training for social workers and caregivers. The website for the Healthy Sexual Development Work Group is the first link you see on this slide, where you'll find all of the regulations and policy I just mentioned. I highlighted just two examples below. One, the ACL is a policy letter from the state which summarizes all of the reproductive and sexual health care rights of youth in foster care in California. They didn't create any new rights, but they realized that none of this was captured in writing, and without that, people were confused, and it would be helpful to just have it documented. The third link is to the guidance for congregate care facilities on their obligation and role, and it has a couple of case examples and frequently asked questions. This is sort of one page of the document that the state created for young people. Young people contributed both information and feedback on the design as well as the language used and the bullet points that they thought it would be important to address. And this is available in 5 different languages on the state website that I shared a link to previously. So the state law and policy has put a lot of new obligations, including this obligation for social workers to have conversations once a year with young people. We knew that it wouldn't be fair to just leave it at that, and so Los Angeles Reproductive Health Equity Project it sort of did a number of listening sessions with foster parents and social workers, and in response has developed a number of tools to help support implementation of these new obligations and policies. Here's just one example. We created some fact sheets and a case manager guide. So it's a one-pager they can bring with them when they're set to have a conversation with a young person. They're divided into 3 different age categories. So a document that you would use with tweens, one for middle adolescents, and one you might use with young adults. And the information, and even as you'll sort of see in the visual, the design is really geared to those different age sets. And you can find those tools on the link at the bottom of this slide. We also created a number of tools to help translate the law into one-pagers. Examples are a one-pager that summarizes child abuse reporting law, that summarizes may, must not do if you work in a congregate care facility, and laws, one-pagers that summarize minor consent laws in our state. And you can find some of those on the link to our fosterreprohealth.org website. I also included here a link to the model curriculum that was developed by our State Department of Social Services here in California. All right, I'm going to pass it back to Felicia to talk about the work in our hands, in our heart, community engagement.
Thank you, Rebecca. So I'm going to talk a little bit about heart. The heart part of our work is about community engagement and communication. Next slide. So our main goal is to end harmful narratives about the sexual and reproductive health realities faced by youth in care as a means to shift perceptions of what it means for trusted adults to support the healthy sexual development and bodily autonomy of youth in care. So I'm going to talk a little bit about how we do that. Next slide. The Youth Advisory Board is our main strategy for community engagement and reaching young people with lived experience in the foster care system. We make it a priority to center young people's voices in this work by convening an advisory board made up entirely of young people, usually 10 to 12 young people who have experience with foster care and want to advocate on improving reproductive and sexual health outcomes for other young people in care. Our board gets trained and coached to deliver presentations. They speak on panels, and they also facilitate events. For example, this picture is showing LA Rep Youth Advisory Board members and Foster Repro Health ambassadors present on a panel at our inaugural conference. The conference drew a diverse audience of almost 200 individuals from child welfare, group homes, health, education, reproductive justice, and a ton more. Another strategy we employ are listening sessions, which actually our Youth Advisory Board members will be trained to host. We do these because it's important to understand youth's perspectives. And here are some of the things mentioned in past listening sessions about learning how to better communicate with young people. So they said things like be inclusive and not gendered in how you ask questions. For example, are you in a relationship instead of do you have a boyfriend? Use broad, open questions, look calm and give us your full attention. Don't assume we are all sexually active and don't assume we are not. Again, we're not homogenous. And don't set a lower bar for us just because we're in foster care. We also have worked on different websites to ensure that there are places online where you can go to find sexual and reproductive health resources. So some of them are teenparent.net, Know Before You Go. So all of these websites have different resources for young people, for trusted adults, for the caregivers, social workers. So I would highly suggest checking some of these ones out. And then this is actually an example of how we had our youth advisory board members do some messaging for us. They basically created these, what we call rights cards, which are actually in DCFS regional offices. They're in the courts, and they're also in medical hub clinics. So they're in a ton of different places here in LA. And so again, they decided on the messaging, they decided on the design, they decided it should be wallet size because they thought it was easier for young people to store. And basically the whole concept, the idea, the creation, all of it was the youth advisory board members, which was really, really cool. And so that's kind of how we try to do things, where we put young people at the center and try to figure out what it is that they want us to know. And then here are two really, really good websites where you can find resources, trainings, and a lot more. They are California-centric, but they're a really, really good base. And as Rebecca mentioned, this first one is fosterreprohealth.org. This is our website, LA Rep. You can find our LA Rep Learning Series on it. You can find a ton of resources about reproductive and sexual health education and all types of things. So.
Okay, so Rebecca here again. We've just presented to you some of the work that we've been doing in California, and that continues. But obviously many of you on this call are not from California, so how do we translate some of this to your work? We know that there already are a number of really exciting and innovative projects happening across both Texas and other states. But we really encourage you to think about whether our head, heart, hands framework might work for you. And so I'm going to sort of present some thoughts using that context. You know, that we think of head as sort of the infrastructure and building blocks behind some of the work we're doing. So thinking about, first and foremost, what is the data, the law, the policy in your location? Do you have policies in your state? Does your state child welfare agency have policies that provide guidance, that provide the can, can't, may, must? We understand from so much research that kind of explicit descriptions, even if it's you cannot, or it's in your discretion, is so critical to the professionals and adults who are working with young people. Are there any policies that explicitly affirm services that teens can access? And are there any policies that explicitly or inadvertently put barriers in place, perhaps around transportation, questions about ability to access contraception or have contraception on their person, or to set up medical appointments? We found in particular that are related to group homes and congregate care, there were a number of, on their face, seemingly neutral policies that were in fact creating barriers and disparate access for young people without intending to in California. It is so critical that we're able to track data about sexual and reproductive health and barriers for youth to care. It was really only when we were able to, across the country, see some of the disparate pregnancy and intentionality data that folks realize what a serious problem we have. And putting in place infrastructures for continuing data collection can be so important to both identify gaps and opportunities, but also to see if the work we're doing is actually making a difference. And this is also a great opportunity to identify champions. There's often folks on the ground who've been doing amazing work, perhaps on their own or within their regional office, and finding a way to learn from them and leverage their expertise in developing new policies and law. And if this is something that folks are interested in, we encourage you to contact us, and we'd be happy to work with you on this. In terms of engaging community, it was critical from the get-go that we had multiple partners around the table with us, that we involved our youth advisory board. And so just a couple questions to think about how you gather information and how you identify some of those barriers that some of us may not realize are barriers. And we put down below some suggestions on resources that we found helpful when we were first putting together our work. We also would be happy to connect anyone with our youth advisory board if folks had questions about how that has worked in their experiences. Finally, in terms of hands, in some ways this can be the most critical, really helping address some of the concrete tools people need to be able to implement the laws and policies that we're putting in place. We found our listening sessions with foster caregivers and social workers to be so helpful to understand sort of where folks were afraid or unsure and what they needed to be able to do this work well and feel good about what they were doing. And that had both to do with sample scripts, materials they could hand out, but also around training and understanding information and sort of the why behind what we're doing. All right, I think I'm going to leave it there. This is contact information for our director, who unfortunately could not join us today, but should you have additional questions after this webinar, or if you're listening to this later on, please feel free to contact Leslie at this email and through our website, because we would be happy to talk to you. But I think at this point we are able to address any questions that there might be either through the chat box or phone lines. Is that correct?
Or through the Q&A box. And so this is Jennifer Biendo, Director of Policy and Data for the Texas Campaign to Prevent Teen Pregnancy. And Amanda and Felicia, thank you so much for that wonderful presentation. We do have a few questions that are stacking up, so I'd like to also remind all participants that they can use that Q&A button that will come up when they hover on the screen to submit questions that way, or also through the chat box if that is easier for you. And we will be sending out a PDF of this slide to all registrants, and we will also be putting the slide deck on our website. So all of those wonderful, exhaustive resources that were included throughout this slide deck will be available for you to really dig into and hopefully utilize. So the first question that we have, did you experience any barriers with local governments or other agencies who were not supportive of talking openly about sexual health?
Yeah, that's a great question. I would say, there's a number of professionals who expressed concern for various kinds of reasons about having conversations with young people. And what was so critical for us was creating those listening sessions that I mentioned, where we made spaces for the adults, the professionals, including the agencies, to talk about some of those concerns. And as you can imagine, all sorts of concerns were raised. Some were religious, some were lack of information, I don't know what to do. Some were fears of liability. I mean, it ran the gamut. And having that and having a space to talk about that helped us understand where we might be able to help support them. For example, if their concern is fear of liability, or I'm not quite sure how to do this or what to say. We can't address everybody's concerns, but we found that there were, and I should say that even in California, we have, it's a very diverse state, and there are all sorts of folks in all sorts of different sort of positions about what, whether this is an appropriate topic to discuss or not. But I think for the most part, people really understood once we showed them the data and the disparities that there was something happening, and that young people, the one thing that we weren't providing was that trusted adult, somebody who could be there to answer questions. And the data on even sexual assault and some of the experiences that young people in foster care unfortunately are more likely to face really help put context around why it is so important. And in fact, our youth advisory panel was also critical. One of our youth ambassadors in one of her speaking engagements shared that she had been, as a child, physically and emotionally abused. And she said, where I grew up, I just thought that's what love was. This is, to me, what love was, physical and emotional abuse. Why would you expect me to think love could be anything different? This is why I ended up in my first dating experience was a physically violent one. And this is why it's so important to have explicit education and somebody you can talk to who can help you see that there is other pathways, that there are healthy relationships, that there are ways to negotiate consent. And we sort of took it back from the sort of the concrete sex and really about framing romantic relationships and how important it is to fill that gap for some young people. And I think that hasn't addressed every concern, but I think that resonates for a lot of folks.
That is very powerful. So another question, and this came in kind of midway through, and you did address some of it towards the end of the slide deck, but this is, I think, a question that will resonate with everybody from Texas, myself included. I'm in charge of overseeing policy, but I can't issue comprehensive policy in a conservative state. What can I do?
Yeah, I hear that, and I think that that's true, even in California for some folks. The first step we did was really look at what is actually on the books and sort of put it in those buckets of what folks are required to do, what they're allowed to do, what they can't do. And I think folks were actually really surprised how much was already there. It just wasn't captured in one place. Including even what is really important to remember is that when we take young people into child welfare, into state custody, that actually puts a legal obligation on the state to address their health needs, and sort of thinking about what that means, reminding ourselves of that, and thinking that we are stepping into the role of parent for that time being, I think is important. But even if you can't create comprehensive policy, having a really clear understanding of what is currently allowable, required, not required can be helpful. And maybe that's creating policy just for your organization, or creating practices or training. Maybe you start with training instead of policy. But having that sense in the first instance of what we already have can be really helpful.
Wonderful. And that's a good segue for us to give a little bit of information about a project that the Texas campaign is working on with partners in the Houston area. It's the Collaborative for Youth in Care, and it's a program to conduct research and look at building support for reproductive health among youth in care, including support for pregnant and parenting foster youth. We're in the early research stages of that project, but we're excited to continue to share information. And in our follow-up email, we will include some information about that project and some ways that you might be able to get involved. We did have one more technical question. Will there be a replay of the webinar? Yes, so a full video and audio recording of the webinar will be posted to the Texas campaign website, usually within about 24 hours. And we will send out an email with that link. for everyone who participated and also everyone who is registered for the webinar. So they will be able to utilize that. And so that is the end of all of our questions. We'd like to say thank you again to our wonderful presenters for such a great webinar and so many really valuable and useful resources. And we hope everyone has a wonderful afternoon.
Thank you.
Thank you.
Thank you so much for being here.